For many of us, the healthcare system is a tangled mess of complex phrases that try to explain the expensive bills we get in the mail. And with the chaos of life, it's easy to quickly pay it without ever truly looking at the breakdown of cost. Unfortunately, the industry knows this and can take advantage of it. Lynn Unruh, professor emerita at the University of Central Florida, experienced this firsthand after seeking help for her spinal issues.
My visit was all of 5 minutes or less. He misdiagnosed me, but did thankfully send me to a physical therapist. And the physical therapist did a good half-hour assessment and diagnosed me properly. And I wasn't happy with this guy, so I asked for, you have to contact the office and ask them for the record of your visit. And they are, by law, I believe, you're entitled to get this record.
In a surprise twist, Unruh's record detailed a much different visit than the one she had experienced.
He said I had a half-an-hour visit and that he did a systematic neurological examination on me, which he did not do. He basically looked at the way I walked in and said, oh, you've got sacroiliitis and blah, 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 blah. And he did my knee reflexes, and that was about it, versus what the physical therapist did this whole big, long thing. So anyway, he lied, and he charged Medicare for a 30-minute visit when he saw me for less than 5 minutes.
Unruh was a victim of upcoding, a type of medical billing fraud when providers intentionally submit wrong billing codes to increase their revenue. It's quite common and has a costly effect. In fact, a 2024 paper estimates that the practice of upcoding was associated with more than $14 billion in hospital payments in 2019. Unfortunately, it's only become more pronounced in recent years, a rise that may be attributed to the uptick in investments from private equity firms in the healthcare space. Why? Because it's a simple way to increase revenue that often goes unnoticed. And as we've seen from private equity's involvement in this industry, the main focus is making a quick profit.
Private equity is investing everywhere in healthcare. It started in some of the urgent care center areas, in hospitals and nursing homes, but it's also gone into doctors' offices, which are all of the specialties. There's pretty much not a physician specialty that you can name that it isn't invested in.
Investments in healthcare are usually seen as a positive. So why is there a negative connotation around private equity involvement? Well, because most reports, like Unruh's 2025 review published in the journal Health Policy, aren't finding many good outcomes in the wake of a private equity takeover.
Out of 21 studies that we found on healthcare quality and patient outcomes, only one nursing home study and one hospital study found that they were better. The outcomes were better in private equity facilities. One hospital study and a couple other studies found no difference in system outcomes, and some found mixed results. But like we say, most of the mixed results studies were mostly negative. So when you look at out of 21, really only 6 were not bad. That's not a lot.
The global investment firm KKR & Company has one of the few good examples. Their acquisition of HCA Healthcare in 2006 showed a significant reduction in patient mortality. However, they declined our interview requests for this segment. The Private Equity Stakeholder Project is a watchdog organization that specializes in researching the effects that the industry has on people and the planet. It covers a range of factors, and one specific topic is healthcare. Michael Fenney, a senior policy coordinator at the organization, says that they're also not seeing many positive outcomes of private equity investments in healthcare.
They may be out there, but what we've observed is that the incentives that private equity firms operate under don't align with long-term care.
Instead of working towards a long-term vision, Matthew Parr, the communications director for the Private Equity Stakeholder Project, says that private equity firms tend to buy and sell their investments in an average of 5 to 7 years.
These private equity firms have a set revenue goal that they're trying to get out of a company, and they're trying to do it very quickly. And because they sell off these companies after about 5 to 7 years or transfer them to another private equity firm, sometimes they take them public or these companies go bankrupt, what have you. After that short period of time, they don't really have a stake in that company anymore. And so if the firm has gotten its profit, they can sell that company off. And they didn't really have to invest in a lot of long-term strategies for the long-term benefit of the company. That becomes a problem a lot of times with healthcare because healthcare is inherently a long-term industry and health is a long-term aspect.
So it's not necessarily the investment that's a problem, but the strategies they use to make the most profit in a short amount of time. And because of how these firms buy in, they get full operating control, despite in most cases not having any significant knowledge of healthcare.
So private equity firms typically do full control buyouts of companies or assets or things like that. So it's a little different than venture capital or other types of investing. Well, they may buy a few shares or they may just own a part of a company. Private equity tends to get a controlling equity interest in a company. So they have operational control and they're able to enforce decisions at the places that they purchase.
They're not people who have any healthcare background. So, for example, Blackstone, which invests in real estate, is a big investor in health equity and healthcare. They don't know anything about running a healthcare institution, but that's who's investing in it.
Research shows that the typical game plan private equity firms use once they've acquired an institution usually starts with cutting staff.
There's not a private equity institution that doesn't initiate a reorganization of the hospital staffing. And so they'll cut nursing staff, for example, may hire more unlicensed or lower licensed personnel like LPNs or nursing assistants and get rid of some of their registered nurses because those are cheaper. So they go with the cheaper staff.
They also typically focus on the more profitable services, often driving up the prices on those while completely cutting the ones that don't make as much money.
So we see a lot of private equity investment in dentistry, for instance, because a lot of times there is dental insurance, but there's a lot of cash flow, people paying cash for procedures. And so that's easy profit for a private equity firm. And so you couple cutting costs with trying to eke out profit and not a lot of kind of future thinking investment. In addition, private equity firms do this tactic called the leverage buyout. And what that means is that they actually don't put a lot of money into the companies that they purchase. They use a lot of debt.
Which means that the firm used very little of its own money in these purchases. Another bonus to this tactic is that the debt gets placed on the company they buy, not the firm itself.
A very popular case right now is Walgreens. Walgreens just got bought out by a private equity firm, Sycamore Partners. Just over 70% of that Walgreens acquisition was actually financed by debt and not from money from Sycamore Partners. But Walgreens is now going to be on the hook for paying that debt, not the private equity firm that owns Walgreens. So in the case of hospitals or nursing homes, or in Walgreens' case, you now have cutting costs, trying to drive profit, in addition, high amounts of debt.
This strategy has been the cause of the financial ruin of many healthcare institutions owned by private equity firms. In fact, the Private Equity Stakeholder Project reports that 7 of the 8 largest healthcare bankruptcies in 2024 were backed by these firms. They also resulted in more than 65,000 layoffs across America. So if these practices are leading to worse patient care, bankruptcies, and closures, are we on a fast track to a destabilized healthcare system with even less patient access than we have today? Parr says it's a fear that's only grown with the recent Walgreens acquisition.
Patients have such direct access to Walgreens. It's in nearly every community. Many rural communities only have a Walgreens for pharmacy access. And so if you take what we've seen traditionally and historically with these firms and extrapolate it to Walgreens, which is in almost every community, and if Walgreens does fail, because like we've seen other healthcare companies fail, you have direct lifelines in communities all over the country that will lose access to healthcare.
A frightening thought, but thankfully one that Parr says isn't necessarily guaranteed to happen. However, changing the outcomes of these investments means changing the operations, a feat that starts with increasing transparency.
The problem with private markets as opposed to public market investment is that there is just inherently far less transparency and disclosure on what these firms are doing, how much money they're making, what their practices are, who's actually profiting, who are the final owners of whatever entity, because we see a lot of financial maneuvering as well, shell companies being created to own things so that it is a little bit more obscure what who the ultimate owner is.
Thankfully, Fenny says some states have started to move towards increasing ownership transparency and pre-transaction review for the private market.
So if a private equity firm proposes a deal in which it acquires a healthcare provider, it would have to receive review and approval from the appropriate state entity. We've also seen states are starting to consider limits on certain practices by private equity firms, including limits on sale-leaseback transactions and dividend recapitalizations. And then states have also started to consider reinvigorating longstanding corporate practice of medicine laws, which keep clinical decisions with medical professionals instead of the corporations that own them.
But even with more regulations and guardrails, Parr says it may not be the best financial decision for healthcare companies to seek money from private equity groups.
We actually see in a lot of different industries, not just healthcare, that public financing of new projects, public investment, actually is a cheaper form of capital than courting a private equity firm for its investment. Private equity returns have not been as good as the public markets recently, not as good as like the S&P 500 recently. And so the marketing that the private equity industry has done as we are the last hope for investment for something before it goes under, or we have the best returns in the business, really actually don't hold up when you look at the data. And so a lot of times, yes, investment is really good, but companies can actually find that through the public markets and do fine and get the capital they need.
You can find more information about Matthew Parr, Michael Fenny, Lynn Unruh, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.